Hi, my name is Renal, and I'm going to be presenting vitamin D. A quick introduction about this vitamin is that the body can synthesize it in significant quantities with the help of sunlight. It's not an essential nutrient because it does not need to be obtained from foods, and there are two types of vitamin D. Vitamin D2, which is derived primarily from plant foods, and vitamin D3, which is derived primarily from animal foods and synthesis in the skin. The reasons that I chose to research vitamin D is because I was curious to see the impacts it had on the human body, and I wanted to see if the stereotypes about vitamin D were true. The roles of vitamin D on the body. Vitamin D functions in absorbing calcium, which helps build bones and keep them strong and healthy, and block the release of parathyroid hormone, which reabsorbs bone tissue, which makes bones thin and brittle. Vitamin D plays a significant role in our health because it protects against cognitive decline, encourages muscle strength, and signals the immune system to defend against infectious diseases. The RDA for children, adults, and pregnant women are listed in this chart. From the minute a baby is born to about 1 year of age, the recommended amount is 400 IU. For children 1 through 13, teens 14 through 18, adults 19 through 70, about 600 IU is recommended. Adults 71 years or older have a recommended amount of 800 IU, and pregnant and breastfeeding women have a recommended amount of 600 IU. Vitamin D deficiency. An estimated 16% of the U.S. population has low blood levels of vitamin D. Factors that contribute to vitamin D deficiency include dark skin, breastfeeding without supplementation, lack of sunlight, and not using fortified milk. A level less than 12 nanograms per milliliter is considered deficient. The signs and symptoms of vitamin D deficiency include getting sick or infected often, fatigue and tiredness, bone and back pain, depression, impaired wound healing, bone loss, hair loss, and muscle pain. Vitamin D deficiency is also called hypovitaminosis D or rickets, and this is when your bones fail to calcify normally, causing growth retardation and skeletal abnormalities, and bones become so weak that they bend when they have to support the person's body weight. Vitamin D toxicity. This is called hypervitaminosis D, which is when the body has over 150 nanograms per milliliter. And this means that there is an excess vitamin D. This means excess vitamin D raises the concentration of blood calcium. This precipitates in soft tissues and forms stones, especially in the kidney. And this is called calcification, which is when the blood vessels hardens, and it's dangerous in the major arteries of the brain, heart, and lungs because it can ultimately cause death. And the amounts of vitamin D made by the skin and found in foods are well within safe limits. So supplements containing the vitamin D in concentrated form should be kept out of reach of children because taking a high concentration of vitamin D supplements or taking too many can lead to toxicity. And ultimately, the signs and symptoms that show vitamin D toxicity include elevated blood calcium levels, nausea, vomiting, and poor appetite, stomach pain, constipation or diarrhea, bone loss, and kidney failure. The 10 food sources that I found that contain different amounts of vitamin D are listed in this table. 1 tablespoon of cod liver oil contained the highest amount with 340% daily value. And the lowest amount that I found was 1 large egg, which is about 10% daily value. Some new and interesting research that I found about vitamin D was that the Vitamin D Council suggests that vitamin D treatment can be used to treat and prevent the following disorders, which is autism, autoimmune diseases, cancer, chronic pain, depression, diabetes, high blood pressure, flu, neuromuscular diseases, and osteoporosis. So from these things, it can be seen that vitamin D plays a very, very important part in our body just by preventing a lot of different disorders, but also like just helping the body maintain a healthy body. However, the results of these diseases are either preliminary or under debate. So without other long-term research, many of the researchers who conducted these initial studies are cautious about recommending vitamin D for the prevention of these diseases. And just to conclude, these are the references that I used in addition to our textbook. Thank you.